PCIT toddler is an adaptation of PCIT. So the first 3 years of life is just a very different time in life, right? And a lot of folks are starting to talk about, kind of 0 to 3 as kind of almost like this extended infancy toddler, right? But where things are very different and learning is really important and the connection with caregivers is paramount, right? And so if you're a parent and you're thinking, I'm feeling really stuck, right, with my toddler, maybe we've hit a new developmental stage, I'm not exactly sure what to do. Or if you're saying like, this is really hard and I feel like our days are kind of a mix of me being dysregulated as a parent and then my toddler being dysregulated as a toddler, and I feel like we're kind of in a just cycle of dysregulation, I would say like PCIT toddler is a great way to just get some practical skills. PCIT is awesome, but what do you do when you're not old enough for PCIT? And as a parent, you're like, I would like some skills, or I'm running into challenges, right? And so the idea was giving parents some skills, both to manage their own emotions, because we know that when you're parenting young children, that can be really hard to do. And when your child is distressed, it can be easy for you to be distressed, right? And so the idea was, how do we take what we know is great about PCIT? How do we adapt it down to an age group where the ideas of discipline and consequence, they don't fit in that age group, right? This is all about connection, attachment, and learning, right? And so what they did is they created PCIT toddler, and it has 2 phases similar to PCIT. And in the first phase, the CDI phase, they teach the pride skills just like we would in PCIT, and they obviously talk to parents about, play in those younger ages and ways that it's different, and really coach parents around the use of those play therapy skills and how to follow your young child's lead. But then they also teach what they call the care skills. So this is about how to help parents regulate themselves, and then how to help parents help toddlers regulate. And then when you get to the second phase is all about learning. So it's super, super simple kind of tasks. I mean, short commands, but we would say it's like, hand me this, right? There's like a very small amount that are appropriate. And then the idea is it's just a learning. So you're modeling, you're reinforcing, you're helping to accomplish this, right? So there isn't any kind of consequence here. There's no punishment here. It's really just about teaching kids like, oh, what happens when someone says like, please hand me this, or please come sit by me, right? What is the response that happens to that? Again, under this attachment lens and this idea of taking care and supporting infant emotion expression, and then also in parents being able to regulate themselves. Often we advocate for families to come more than once a week, because when you're a baby or a toddler, right? And this has been done kind of in that 12-month to kind of, 36 kind of window. We're saying, hey, you come in, we're gonna teach you some skills, and then we're gonna coach you to help you figure out how to execute that in a way that's genuine to you, that fits your parenting values, that fits the culture of your family, right? And we're gonna then just help you kind of find this set of tools for yourself as a parent. So yeah, if you hear me talking about, parents being dysregulated or toddlers being dysregulated, when we think about what that looks like, as a parent, that could be feeling anxious, right? And you might be having racing thoughts. You might be thinking, oh, I don't know what to do. My child is distressed. I don't know how to make this better. Maybe you're thinking, oh no, I did something and now they're upset and I don't know what to do. So it could be kind of more cognitive, right? You're having thoughts going through your head. It could be physical or physiological, right? You could just be kind of feeling really tense. You could be feeling kind of anxious in your body, I guess is a way I would think about it. It could be feeling a little shaky, right? You could be having strong emotions. You might be thinking or having feelings of like worry or stress or And so those are kind of all signs that you might be experiencing some dysregulation. In addition, when we think about toddler dysregulation, that is often easier to spot, right? That is often yelling or screaming or crying or falling down on the floor are all potential expressions of toddler dysregulation, or potentially just kind of seeming like frozen. They don't know what to do and they're just kind of fussy and irritable, right? Those are all versions of a toddler being dysregulated. And so part of what we want to do in PCIT Toddler is give parents the skills to be able to manage their regulation, and then for them to know, like, how do I help a child who is in this state of dysregulation?